The Niagara Health Engagement Network is committed to creating a safe environment for patients, families, staff, and volunteers. Volunteers are given the designation of patient partners and provide the role of sharing experiences and perspectives that will help make meaningful improvements in the quality and safety of patient care. Joining me in the studio today are three representatives who will guide us through the recruitment process. Caroline Campbell, you are a Senior Patient Experience and Engagement Specialist with Niagara Health. Can you tell us what the Niagara Health Engagement Network is?
So it's a network made up of patient partners. So patient partners are patients, families, caregivers, community members who volunteer their time with us and work alongside our staff and physicians to improve the care and services we provide. So they might belong to committees, working groups, co-designs, projects, and they share their voice and their perspective to make sure that that patient voice or caregiver voice is at the table for all the decisions we make in the hospital.
So can you give us an example of a time when one of the patient partners made an impact on a decision or made an impact on the community?
Well, we actually now have a patient partner on our board of directors. So she, at the highest level, is impacting the decisions we make at Niagara Health, but we have patient partners functioning at all levels of the organization. So an example is our Patient Experience Steering Committee. We have a number of patient partners that sit on that committee with our staff and physicians, and they've actually co-designed our first ever patient experience plan. So they've been a part of the whole process over the last 15 months and really instrumental in our first ever patient experience plan at Niagara Health.
Oh, it's so important to have the input of the community and the people that are using the services. Candace Park, you are a patient experience coordinator. Can you let us know what the process is for applying to be a patient partner?
Yes, it's a very simple process to become a patient partner. So you can go to our Niagara Health Engagement Network webpage and there's an application online. You fill that out. Caroline and I will be in touch with you. We'll have a very informal meeting with you just to get to know a bit more about yourself and what your interests are and why you want to become a patient partner. And then after that, it's just a simple orientation as part of the onboarding, and then you'll be added to our distribution list and you'll be officially a patient partner. We'll get you a nice badge and you'll be able to engage where you see fit, what you're interested in and what you want to participate in.
So there are multiple ways to engage as a patient partner. Can you tell us what some of those are?
Yeah, there's, so as Caroline had mentioned before, there's committees. We have a lot of different committees throughout the hospital, so patient partners can sit on committees, special projects, working groups. We're currently onboarding patient partners for our accreditation steering committee, so we're going to be doing an advisory group for our 2027 accreditation cycle. And there's just several different types of ways that patient partners are embedded throughout the organization and ways that they can engage.
Wonderful. And Sarah, you are a patient partner, so can you tell us a little bit about why you wanted to get involved and some of the duties that you have as a patient partner?
Yeah, I originally started volunteering actually in 2015, just as a volunteer at the front. Okay. And the reason I volunteered was going through my dad's palliative care, so I was there a lot. And it was just a way for me to give back. But then in 2019, when the patient partner program came around, I just thought it was so forward thinking and just something that aligned with my values, and I just wanted to be able to be that voice of a patient or a caregiver and just help in some way.
So what are some of the things you've done as a patient partner?
I've been on the palliative care committee. I've been on a cancer care committee. I've given input on posters, patient handouts, some web redesign input. I've been involved in some hiring for, I think it was a manager of radiology, just from a patient perspective, and was able to ask some questions. And
wow, what a great learning experience.
Very much.
Too, right?
Very
to understand how decisions are made and what's happening at the hospital. That's so great. So for someone who might be at home watching this and thinking, oh, that might be something I'd love to get involved in, what do you think makes a good patient partner?
I think anyone would make a good patient partner if you have the passion to improve things for the community in our healthcare. You can give as much time as you want to it or as little, because they do a very good job when they put out the initiatives of what the time commitment they're looking for. So you can join as many or as few as you want, depending on your time and your interests.
What do you get out of it?
It's so rewarding. I can't even describe it.
I can imagine.
Just being able to have a say and being able to help someone, knowing that what I went through, and just being able to be that voice.
Okay. So Caroline, can you tell us again, for someone who's interested in getting involved and perhaps being a patient partner, where can they go for more information?
If they go to our Niagara Health website and search Niagara Health Engagement Network, the Apply Today button is right on the website, and it'll come to Candace and I, and then we will reach out to them.
Okay, excellent. Thank you all so much for being here. We'll hope to have you back and talk to you again.
Thank you.
Thank you.